You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, you can get a fixed set of teeth in just a few appointments. We're discussing mini implants today. With us, we have Louisville's dentist, Dr. Stroud. Dr. Stroud, welcome to the show.
Hey, Randy. Good to see you. Good to be back.
Now, it's been 5 years. We had you on 5 years ago.
Right.
You were talking about MiniDental Implants then.
Right.
And we're back. What's changed?
What's changed with mini implants was, 5 years ago, I had done some of these, and we had been doing them for a couple years. And now here we are 5 years later, and we've done over 7,000 of these things, and it's been pretty amazing.
You said every single day, a denture wearer comes in, and you do mini implants every day. You do a mini implant case.
Right, Randy. I'm doing enough of this stuff. I'm doing so much of this stuff now that we're doing this on at least one person, one or two people every day. I mean, I'm putting in 10 or 12 of these mini implants every day.
Okay, now for people that don't know about you or your center, tell me a little bit about your practice, who's the typical patient, and what are the different procedures you do? Well,
I was a general dentist, Randy, that I was frustrated because so many people with dentures, so many people are frustrated with their dentures, and and they just have a time with their dentures. They hurt, they rub, they won't stay in, they can't eat, they hate using all that adhesive, they hate all that palate, that plastic in their mouth.
Covered the top?
Yeah, covering the roof of their mouth. And embarrassed about their smile, won't go out and eat.
But I know some denture wearers, and I never hear them complain about. I mean, is it really that big of a problem? People don't like their denture?
You're probably not going to hear it. They're not going to complain to you, but they come in, they complain to me. And yeah, people have fits with their dentures. And in the past, we didn't have any real good solution to help people with their dentures. The only thing they could do was go to the surgeons, have the typical surgical implants done, and that would work okay, but a person would have to go through a whole lot. You'd have to go through multiple surgeries, maybe over a year's worth of healing time. And it's quite expensive, and so only a small majority of people would do that. But now with the mini implants, it's just, we have a pretty amazing way to help people in just a visit or two in a short time without going through anything real hard and no surgery, and so it's been pretty dramatic.
I asked you before we started, right before the cameras went on, I said, how many visits in the perfect scenario could a denture wearer walk in your door? How many visits would that have to be? Well, in a perfect scenario, they get a fixed set of teeth, a full arch of teeth.
Yeah. We've actually done this in 2 visits. I mean, this would have been unheard of, Randy, a few years ago, but I mean, we've been doing this over the last few years. We've been doing this routinely. But a person can walk in with existing dentures, and 2 or 3 visits later, walk out and just be wearing permanent teeth in their mouth. They have no more plate in their mouth, and it's a pretty amazing thing for people. They have no more plastic.
It seems very painful. And I think I asked you that, told you that the last time.
Yeah, well, everybody, when I'm discussing the procedure and they're looking at it, they say, oh, that's got to hurt. But the reality is, there's really not much to it. We're not cutting on the gums. It's not like a surgical procedure. We're not cutting on the gums. There's no stitches. All I'm doing is just
the bone.
All I'm doing is just numbing the gum. I'm just numbing the gum. Like when a person's had maybe a little filling done or something. I'm just numbing the top of the gum, and these implants actually screw in. And
so the bone doesn't have feeling?
No, it doesn't have feeling at that point when I've numbed the top of the gun. In fact, when I put the implants in, there's really no feeling or no sensation. Most people are actually kind of shocked as I'm putting these implants in. I say, okay, we have 2 in now, we have 4 in now. They're going, oh, wow, and they're not really even feeling anything. So it's.
How many denture wearers would you say are in Kentucky?
Oh my goodness, 1 million.
Is that
maybe?
Right? Like an upper or lower denture, 1 million people?
Probably.
Now, why aren't they all doing this? Because, I mean, you're a big fan of this, to lock down your denture with mini implants.
Yeah.
If it's so good, what's your take on that? Why they're not doing it?
Well, I just don't think they know about it. I mean, the message hasn't gotten out there enough. I mean, people are familiar and maybe somewhat know about implants, meaning surgical implants, but they know that's super involved and they're scared because they know it's going to hurt and it costs, you're talking $30,000, $40,000 and even more that they're talking about for this kind of stuff. For most people, I think it's just some pie in the sky thing that they would never consider, and they probably don't even know that it's possible with these mini implants.
I mean, you're more than half off of that, 80% off of that price.
Yeah, it's way less than what they do for the surgical stuff.
But the main thing is it works. I mean, because I told you that before when you were on the show. I looked at my interview with you from 5 years ago.
Right.
I was skeptical then. I'm skeptical now. Because I guess there's a lot of people that are afraid of mini implants, a lot of other dentists, and so set the record straight.
Well, it's some guys for years have said and thought that these would not work, and there are always people that think.
Are there scientific published articles that this is working?
Well, yeah, I mean, just within the last year or so, probably the most recent and best, I guess, scientific article was a study that was done following, I don't know, several thousand of these implants over a few years. And the research all showed that these were actually maybe slightly more successful than the surgical implants. And the main evidence, or the best thinking we have on that, is that probably because it's non-surgical. And if you think about it, going through a surgical procedure, especially if someone is, you know, maybe has some health issues or something, it's a big deal to go through, and they're cut open, and in the healing, it requires a lot of healing. With the mini implants, being non-surgical, it doesn't interrupt the blood supply. You're not cutting the gums open. There's not that much to heal because everything stays intact, and the blood supply is good, and everything can just heal up real nice and naturally without having to go through so much. So.
What are the frequently asked questions? Okay, denture wear goes in. What is that consult like? What do they ask every time? What do they want to know?
Well, they're curious about if they're a candidate, because sometimes they've been told by other dentists that they're not a candidate, or they don't have enough bone, or they wouldn't be able to have it done. So they're curious about whether or not they're a candidate. And most people, by the way, are a candidate, because the mini implants, I don't have to have as much bone as they do for the surgical implants. I've got to have some bone, but not a whole lot of bone. So a lot of people, in fact, most people are a candidate for this. And then they want to know, is it going to hurt? Okay. That's always a biggie. And I described that to them, kind of like I did you. We're just going to numb the gum a little bit.
So it is hard for them to believe that they are candidates when they come in?
Well, yeah, a lot of them are very happy and tickled to death just to know right away that I can help them, and they're a candidate, and that we can do this.
You say you're changing people's lives. Elaborate on that.
Well, you know, as a general dentist years ago, I didn't often get a hug from doing a root canal on someone. But but nowadays, you know, when I do this stuff and I can give people their teeth back when they've been so embarrassed, so self-conscious, you know, won't go out to eat, you know, practically a hermit, and I hear these kind of stories just over and over.
They tell you that
all the time, and we'll talk more about it. And then I can put a person's teeth in, and they look in the mirror, and you know, and they just get up and give me a hug. It's just,
right?
it's just
Do they get emotional sometimes?
Very emotional, very emotional.
Is this one of those things where they say, you know, I should have done this years ago?
I hear it all the time.
Do you?
I hear that all the time. I hear, why wouldn't everybody do this?
So you brought some photos.
Yeah, got some photos, some cases we can talk about if you like. This is,
all right.
This is Mary, okay? Mary had been a long time denture wearer. And you know, so you can see that, and this is typical, Randy, what happens to people. And I see a lot of people in this same kind of category. They've worn dentures for a long time, and their mouth, their gum, and their bone has just gotten all worn down. And the mouth gets kind of scrunched up or wrinkled up. And a lot of people are familiar with this sort of thing because they've had it happen. And it's just strictly from the dentures, wearing the dentures all those years. That's what they do. They cause the gum and the bone to just be worn away. So to correct that, or at least to stop that process, when we put implants in, any kind of implants that we put in, it stops that process. So they keep their bone, keep their facial
structure.
Because of what, the pressure? Yeah, just that pressure, that contact actually prevents the future loss of bone.
So this woman comes in, what's her biggest complaint?
Okay, well, Mary comes in, and this is typical too. She really couldn't eat. She couldn't wear a denture, she couldn't eat. Her gums and bone, it's all gotten worn down so much that there's hardly anything there, so she can't really use her dentures. To use them at all, she said she has to go through about a tube of Polygrip a day. Put it in there, try to get through a meal, they're flopping out again, go to the bathroom.
Do they tell you that? I mean, literally, if they eat?
Exactly. They tell me exactly that. They can't even go out to eat because they'd have to get up several different times.
She just has to eat?
Well, in fact, she said
soft food?
She can hardly eat. She's choking when she eats. She said she's practically on a liquid diet. And she's, on top of that, just so embarrassed with the way she looks, she would hardly go out and eat.
So how soon? Okay, from the time they walk in, how soon before you give them the good news or not so good news that they're candidates?
Well,
like with her, how soon do you say, this is going to be good?
With Mary, she sat in the chair. I went in and met her. Her x-ray is on the box in the room. And within a few minutes, you know, I know that we're going to be able to help her. In her case, she doesn't have much bone. Her gum and bone had gotten pretty worn down, especially on the bottom.
Like how many years is somebody like this in a denture?
30, 40 years.
30, 40 years, and they could still
30, 40
qualify for this.
I mean, a lot of people think that they could not have anything done at that point. They're so worn down. And a lot of people have been told they could not have anything done. But the fact of it is, with the mini implants, we've been able to help a lot of people like this.
Do you ever have people that go in on a consult and say, well, I had another dentist tell me I didn't have enough bone?
Yeah, many times.
Or I couldn't do it.
Many times.
Many times, that's not an exaggeration.
Many times, and we've helped them with the mini implants.
Did they get frustrated?
Because remember, I was saying we don't have to have a ton of bone, but I got to have some bone with the mini implants. So
but everybody has some bone, obviously.
Well,
or no?
Most. You're right. You're right.
Okay.
Most people have some bone. So that's why I was saying most people are a candidate for this. It's
so
not very often that I see someone that we just couldn't help.
And I interrupted you, but this woman comes in. Okay, so you tell her. What do you tell her? I mean, do you give her options of? Because I guess some could snap in, snap out.
Well, actually, in her case, with the minimal bone she had, her best option was to just do snap-in dentures, where she's going to have some implants, and they'll hold her dentures, so they'll stay in there and work. So that's what we ended up doing for her. So we did her case. We made her new dentures, did her implants.
She looks.
I mean, look at the difference.
She looks a lot different.
I mean, look
obviously.
at the difference after.
And she's smiling. Okay.
First thing we had to do was rebuild her mouth, to fill her mouth out, just to aesthetically, you know, make her look good again. We had to fill out and correct for all those years of destruction. So when you look at her smile, you can see there how much better her smile looks, and the way we designed the teeth there, you can see how
it's like a cosmetic. I mean,
yeah,
it looks
you
good.
can see how we try to make their smile look good. You know, the front teeth, for instance, you know, you want them a little bit longer than the others, and
that's right.
The line of the smile should sort of go along with the lower lip, and you know, we try to do some things to make them look good. But anyway, we had to rebuild and refill her mouth out to get her smile back, and then we put her implants in. And
are you doing bone grafting in these?
No bone grafting. Don't do any bone grafting. I mean, a lot of people are told that that's what they would have to do to have the other surgical implants done. But no, we don't do any bone grafting.
So these are not to be confused with regular dental implants. These are mini implants or small diameter implants.
This is all I do is MiniDental Implants.
That's all you do. Isn't that the name of your practice?
We don't do any surgery, any grafting.
What's the name of your practice? Has something to do with that.
Louisville MiniDental Implant Center.
Is that right? And how do people
That's
hear?
what we do.
Do you get a lot of word of mouth, by the way? Because denture wearers hang around with other denture wearers.
Yeah. Sometimes we do. A lot of people see me
on TV.
On TV and some of the other TV.
Do they feel like they know you? They've seen you for years.
Well, yeah, I do kind of get that from people.
Do they ask about me every once in a while?
Sometimes they do.
Okay, good. We'll have to find out what you tell them.
Sometimes they say, "That Randy, he's giving you a hard time."
I know. Well, you know, people need to know these are real interviews, and I'm not trying to endorse you or side with you, but you know, you've kind of convinced me that it works. And you've shared with me that scientific literature that's out there. So a woman that does this, okay, so the turnaround time, how soon, so she has a full set of teeth, snap in, snap out, how firm are they? I mean, could she eat like chicken?
Well, we made her new dentures and got her implants in, and she tells me that now it's like a changed person. You can see how she's smiling there, but she is no longer using any adhesive. Her teeth are staying in good. She's going out and eating what she wants to eat. She's not self-conscious about it anymore. They're not hurting anymore, and so she's you know, she's loving life. And I have letters and comments from her as well as a lot of other people that tell me things like one guy in particular. I remember he didn't have much bone either, and we put his implants in, and he was so happy. He told me he ate his first salad he's eaten in 6 years, and I get comments like that where. You know, just ate steak or just ate corn on the cob.
They can eat a steak. Some people.
I can eat nuts now, and you know, you have comments from people that they're back to eating, you know, the different things that they like to eat. So,
is this the future then of dentistry, where dentures, traditional dentures as we know them today, whether it takes 20 years or 50 years, do you think in the future everything will be held on to some sort of implant?
Well,
is that your thought?
Yeah, it's definitely going that way, and it's definitely going that way. And the mini implants are so big, and more and more guys or dentists are learning about them and starting to do them, and I think it is, you know, the future.
So this isn't gimmicky. I mean, this works.
Of course it works.
It's solid. It works.
Yeah. I mean, I'm over 7,000 of these things now, and so.
So on the consult, okay. So denture wearer goes in. You have some models. What do you show them?
Well, okay. Let's talk about the case of the snap-in dentures, just like what we talked about there with Mary. Okay. This model is showing the upper gum. Okay. This is the upper gum. We put in the mini implants, okay? They're kind of
like... Those are little.
Yeah, they're kind of like long, narrow screws, okay? But what's different about these things is the way they're placed, okay? I don't put people to sleep in my office. I never do. You're wide awake. There's no cutting of the gums. All I'm going to do is just numb the gums in these little spots right on the top of the gums.
How many implants is that I'm
That's 6 implants. And
Let me take a look at this.
That's typically what I'm doing on an upper case.
These are very interesting.
Okay? So all I do is numb the gum. Little pinches where I numb the gum, and that's really all a person feels.
Do you show this? By the way, this is exactly what you
This is exactly what I'll talk to a patient about. So I'll numb the gum with some regular little Novocaine, and that's all that you'll really feel. and then these implants screw in. You really don't even feel it.
Hold that up for the camera for just a second. Let me see that.
Yeah, okay, now here's the upper denture with the little snaps in them, okay? So here's your mouth over here with the implants, and then that same day your denture goes like this, snaps in place, and then a person will leave and their denture will snap on and off like this.
And that's for the upper?
That's the upper. Hold that, Randy, and pull on that. You'll kind of get the idea.
I'll try not to exaggerate here.
See what I mean.
Okay, good. So it's very nice. Let's see if we can hear that snap.
And a person learns in their mouth how to do that, and they snap in and out to clean them.
So the roof of their mouth is no longer covered?
Well, with dentures, we can cut out some of the palate, okay? You're still wearing dentures. We can cut out some of the palate to make sure you're not going to gag. Yes, we can, to make sure you're not going to gag.
That's nice.
Okay? So, and then a person takes them out once a day to clean them and snap them back in, and, you know, I have just tons and tons of people that we've done this for, and they're just, you know, tickled to death and working great.
If there were like a tryout period, and I'm sure there's no such thing as this, but okay, you ran an ad that said, come in on a Friday, all you denture wearers, right, and try mini implants for the weekend, right? Do you think if you did this try-in period that nobody could go back to their loose-fitting denture? I mean, is it that big of a difference is my question.
It's a huge difference. It's a huge difference. It's a difference from them not being able to wear their denture at all, to use their denture at all, basically, to now it's snapped in and staying in, and they're eating and talking and smiling and not having to worry about it.
Are there people that worry that, like, if they laugh out loud or speak out loud, that their denture is going to fall out?
Oh, that's a big one, Randy. Worry. I mean, I hear that from a lot of people. A lot of people. They're worried, self-conscious, worried that their teeth are going to, you know, come loose when they're out eating or talking. That's a big fear.
Is there a tipping point that people decide to do this, like a divorce? Some mishap happens with their denture?
A lot of times it is. A lot of times people have been struggling for years and years with it. You know, they've gradually lost their teeth. They've been hurting. They've been in pain.
So this lady right here, by the way, how many years do you think she put this off? Like, she was thinking about it. I mean, how many years was she miserable with her denture?
Years, many years, probably many years.
Interesting.
And that's typically the way people.
So obviously you want to get these people in early.
Yeah, I mean, most people will tell me, gosh, why didn't I do this 10 years ago? Why didn't I do this 15 years ago? I mean, I hear that all the time.
Okay, you have other photos.
Yeah, yeah. This is Bob. Let me just tell you about Bob real quick. He had been losing teeth since he was young, went in the military, lost more teeth, had to wear partial plates, hated them. They caused more damage. His wife got sick, put off treatment even longer. Finally, he got in and got to me. He was at the point where he was just so self-conscious about his mouth that he didn't even like going out.
And they don't smile, is that right?
No,
I mean, these are people walking around Louisville, you think they're mad.
No, he wouldn't smile. He wouldn't smile. And he was so self-conscious he wouldn't go out. Well, anyway, we did his teeth. We did his teeth, and look at this guy now. And he is just, and I got to tell you, when we did his teeth and I put his teeth in for the first time and handed him a mirror, he sat there motionless, and I watched tears start coming down his cheek when he looked at himself in the mirror. And then he got up and hugged me. I mean, he is the greatest guy.
You must get choked up a little bit every once in a while. Or are you past all that?
Yeah, I do, especially with some of these people. And he's just he's just the greatest guy. I see him at church, and now he's just smiling big. He told me the other day, because we just did his recently, he told me the other day, he said, I just ate corn on the cob, and doing well, loving going out again. And he told me, he said, this is the second best thing I've ever done next to my son being born. Randy, you know, hold his picture up there again.
Okay.
Robert, his after picture. I mean, you know, it just means so much to people, you know, to be able to smile. I mean, look at that smile on him, you know, versus before. And, you know, a smile is such an important thing. And so many of these people are just so self-conscious they hate to smile. And people would think they're, you know, they're mean or they're angry or they think they don't like you or whatever.
Nobody would think this guy's mean.
But, and now look at him.
You know, it's interesting, because I always think you guys are exaggerating that come on the show about certain things, but truly, if you saw this guy and he flashed that smile, it would put you in a good mood.
You know, we don't think about it, Randy, because, you know, I have pretty good teeth and you have a nice smile, and we don't think about that much, but I see it all the time. And it's, you know, it means everything. It's at the center of everything. It's the first thing that you notice on a person. It's the first thing that you notice. And so many people are just so miserable and self-conscious and you know, go around like this when they're talking to you. And
do you spot those people?
See it a lot. See it a lot. So it means everything. It's you know, it's changed these people's lives when they can feel good about themselves and smile.
What are the categories of mini dental implant patients that you see?
Well, the first one would be the people that are frustrated with their dentures. They hurt, rub, won't stay in, can't eat, hate using all that adhesive in them, hate that plate in the roof of their mouth. Those people, we get them in, put the implants in, they end up with their dentures snap in and out. A lot of people now are frustrated. A lot of people want to be rid of their dentures entirely and not even have any more denture plate in there. And there's a case there we can talk about.
Okay.
If you'd like to
okay,
talk
let's
about
take a look at it.
A lot of people, and we're doing this more and more, and this is what I was talking earlier, is amazing how we can take a person from a denture to just fixed teeth that'll stay in and wear no more denture.
A full arch of teeth?
Yeah, just teeth only, and be rid of their dentures and nothing come in or out, not have to take anything in or out anymore, and they don't have any denture or anything in there. And this is what we did here for this is Debbie.
This is before.
This is Debbie, okay?
Okay.
You can't really see any teeth there because there aren't any teeth there. She doesn't have any upper teeth. She lost some of them early. She was actually working construction when she was younger and got hit in the mouth, lost some teeth, had to wear a partial, hated that partial plate, just hated the fact that her teeth had to come in and out, and she just felt real self-conscious about it, that her teeth would have to be out at some point during the day, whether her husband would see her or anyone would have to see her whenever her teeth come out. And then she lost more teeth, and then she hated that plate in there because she'd get stuff under it and that would hurt, and that plate in her mouth would make her talk funny, and so she hated all that stuff. So anyway, we did this procedure for her where she could just be rid of her denture and just have her teeth put in. And here she is. After that.
Very nice.
And now that she has that done, we put her teeth in, and she couldn't believe it that day. She felt around up there with her tongue, and she's not feeling any more plastic or any more plate in her mouth, or nothing's covering her gums, and it's just her teeth there.
That's a fixed set of teeth with mini implants.
Right. That's just teeth that stay in. That's the other thing that we can do for people.
I mean, I literally have been told that can't be done.
Yeah, we're doing it all the time. Doing it all the time.
Is that right?
Doing it all
and what
the
does that look like? I mean, how many mini implants?
Let me show you. Okay, here's the upper gum. Okay, this is showing the upper gum. Kind of like before, we put in these mini implants, the same type of mini implants, except what we're going to do is we're going to put in more of them.
And that's not painful. I mean, it looks painful.
I know, that's what everyone says.
Okay.
But after we're done, they're amazed that it went so well. All the person really feels is the initial little numbing when I numb just the top of the gum. So we're going to do these things. There's the same mini implants. We're going to put it in just like before, except we're going to put in more of them. We're going to put in 10 or 12 of them. Okay? And in this case, what's going to happen, instead of their dentures snapping in and out, they're going to have a new set of porcelain teeth made.
Let me take a look at that. Okay.
This is just a model, but it's just going to be a set of teeth where it's just teeth only. No plate, no nothing anywhere. And then what's going to happen is after we have these teeth made, they're going to cement onto the implants permanently. Now these cement on with something that, I mean, this is not coming off. So they just have their teeth. There's no plate anywhere. There's no plate in their roof of their mouth, nothing under their lip. It's just their teeth there that just stays there. Nothing comes in or out. And that's what Debbie had to say. You're talking about, worrying and
what
stuff.
What could she eat, by the way? I mean, she could eat now?
Yeah, she's back to, back to eating everything they pretty want to eat. Because when we do this, the
teeth
teeth
eat broccoli, by the way?
I don't see why not. I don't know if anybody's mentioned broccoli to me, but I hear all the other things.
I guess like, because I like broccoli, that's what I'm thinking about.
I hear, steak and corn on the cob and nuts and all those kind of things. But that's one of the things she told me is that she just feels so much more at ease and doesn't worry about her teeth.
She's young.
Because she's still kind of so young. So she doesn't worry about her teeth coming loose, and she just has so much more peace of mind.
But isn't that what everybody wants?
She can talk better, eat better. She just feels so much more confident with them. She told me, she said, everybody should do this. That's what she told me. Everybody should do this. So,
do they ever say, why isn't everybody doing this?
I hear that a lot. Why wouldn't everybody do this? I hear that a lot.
And what do you say to that? They just don't know about it.
I say I wanted the same thing. They just don't know about it. They just don't know about it.
And the ones that do know about it don't believe it.
Well, sometimes that's the case.
Sometimes?
Even people come in and see me, and I show them this. Sometimes I'll say that.
So no more dentures, no more traditional dentures.
Don't have to. Be rid of them. Be rid of them if you want to.
You get a fixed set of teeth. And is there age? I mean, you have to have a certain amount of bone to get the fixed? Is that right?
You probably have to have a little better bone, a little more bone to do the fixed permanent teeth.
What's the oldest person you've ever done the
snap-in
fixed?
dentures? 90.
Well, geez.
90.
Really?
Guy came in to me with a denture. He hated that upper denture, hated that plate, hated having that plate in his mouth. He had just come from the surgeons, in fact. He had just come from the surgeons. It was going to be $40,000 to give him his teeth back. Okay, well, I ended up doing it for him for way, way, way less than that, and in a couple of visits, and he just has teeth in there and not wearing a denture anymore.
Is that right? Good for you. Do you ever go home and tell your family, had a good day today?
Well, sometimes. And sometimes I'll show them the pictures, because I take pictures of all
Do
this
they
stuff.
ever just say, look, we've heard enough of these mini implant stories?
Well, I think what they hate the most is I got all these pictures all over the computer. So you know, when my boys are on the computer and I have these, you know, all these teeth pictures popping up, you know, I get tired of that.
Is that right?
So.
Good. Now, so final message. I mean, somebody watching this, they're wearing a denture. Maybe they've been told they don't have enough bone, or they think they're too old, or they're afraid of the procedure. They think it hurts. What is your message to the denture wearer that's still skeptical?
Well, I think, you know, I just hope that they would just come in and check it out, because, you know, when a person comes in, or at least in my office when you come in, I just sit down and talk to them. We don't even charge to do that, but I just take an X-ray and talk to them. And
so there's no charge for a consult to you?
That's the way we do it. Yeah, that's the way we do it.
Nice.
They don't pay anything unless we're going to help them. So they have the X-ray there, and we just talk to them and look, and usually within a few minutes I'll know pretty much if they're a candidate and what we're going to do, and I show them these models like we've been looking at here, and discuss the options, and you know, and see if they want to do something. But now we can help people. We can help the average person and help a whole lot more people that are frustrated than you could before, because with this non-surgical option, it just makes it's just a procedure that anyone can go through. People that are even a lot of people have health issues, some pretty serious health issues, taking all kinds of medicines, blood thinners. We don't even have to change those. We don't even have to take people off blood thinners to do this stuff, because there's no surgery, there's almost no bleeding, so it's so non-invasive, minimally invasive, that we can do this on about everybody.
But you just don't deal with, and we're out of time, but you do single teeth, people that are just missing certain...
It can be 1 tooth, 2 teeth, 3 teeth, all their teeth, doesn't matter.
To come see you. Consultations are free. They get to meet with you on the consultation every time?
Oh, yeah. Just me.
All right. Well, I want to thank you for coming on the show. Very interesting. And by the way, so you have your own YouTube channel. You've got videos of patient testimonials.
Right.
And these photos and more are on your website.
Yeah. They can hear a lot of people's firsthand account of doing this stuff.
Okay, good. I want to thanks again for coming on the show.
All right, thanks, Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com and just put in Dr. Stroud or Larry Stroud. You'll find him there, or Mini Implants, and he'll pop up there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.